Good evening, students. Good evening, dear students. Please confirm if audio, video, everything is fine at your end. I hope you all have joined in. Please let me know if everything is fine at your end. You can hear me. Then we'll start. Okay. So today in our MDS 360 degrees for oral surgery, in today's session we are covering a topic known as distraction osteogenesis. All right. In today's session, we will be mainly focusing on the protocols of distraction osteogenesis. Okay. This topic can be a little tricky. Okay. And it can be a little difficult to understand. So I'll try my best to make you explain what is the idea behind distraction osteogenesis, how is it done, and what are its different phases or protocols. This is all that we will be seeing in today's session. Okay. So let's start by looking at the definition of distraction osteogenesis. So distraction osteogenesis is a slow application of force to an osteotomized bone, thereby widening the gap and resulting in production of new bone as well as soft tissue. Good evening, Shweta. So this is the definition of distraction osteogenesis. So basically what are we doing in distraction osteogenesis? We are osteotomizing. What is osteotomy? Through and through cutting of the bone. Complete cutting of the bone. Alright, through and through cutting of the bone and dividing it into two halves is an osteotomy. So in more simpler terms, I'd like to tell you that intentional fracture of the bone by surgeon or by clinician is known as osteotomy. So in distraction osteogenesis, we are doing an osteotomy, applying a force across that osteotomy so that when you apply a force, a gap will be created, and in that gap you will facilitate formation of new bone as well as the soft tissue surrounding it. Now let's look at a few line diagrams to understand the process of distraction osteogenesis. Let's have a look. So this is your bone. Okay. You do a osteotomy. Okay. Now where you have done the osteotomy, you gradually separate that area. That means if this is fragment 1 and fragment 2, you try to create a gap in between fragment 1 and fragment 2. So basically you are pulling the two segments apart. Osteotomy, first step, pulling the two segments apart. Now what will happen? Now the bone will try to regenerate, repair itself. So what will happen? There will be formation of fibrous callus. Fibrous callus. Okay. Now what will happen next is this fibrous callus will undergo mineralization, will undergo calcification, and it will lead to new bone formation, dense mature woven bone formation. This is mature bone. Okay, so here what is happening is, this is basically between these two steps there is calcification of callus taking place, calcification of fibrous callus. Okay, so this entire process from osteotomy till mature bone formation, this entire process, this is distraction osteogenesis. Okay, I'll quickly repeat again so that you understand. So first what you do is, you do a osteotomy. You cut the bone into two. Okay, then you apply a force across both these segments. You pull them apart. Okay, what is actually done in the distraction process is, every day you pull them apart little by little. How much you pull them apart every day we'll discuss later, but you pull them apart little by little. So when you create this gap, in that gap fibrous callus formation takes place, and which ultimately calcifies or mineralizes into strong mature woven bone. Okay, now how is this done? So there is something known as a distractor device. Okay, something known as a distractor device. This distractor device is applied across the osteotomy. Okay, this is screwed to the bone, the distractor device, and this distractor device has a slot where I've drawn the arrow. So like if you have seen those nuts and bolts which are available with your furniture, so that nut has a key, you insert that key and tighten the nut. Alright, similarly this distractor device has this nut, bolt and key type of a slot. You insert the key in the slot and you turn it. So once it turns, it will cause separation of the osteotomy, or it will cause the osteotomized segments to move away from each other. So this is your distractor device. Okay, this is your distractor device. Fine. I hope this part is clear. Distraction osteogenesis, the process of it. You can just remember this diagram and you will never forget the concept. Okay, now distraction osteogenesis or calotasis. All right, it means the process of generating new bone by slow stretching of callus in a gap between two bone segments by application of graduated tensile stress across the bone gap. So basically you apply a tensile stress across the osteotomized region that leads to formation of callus. It is called as calotasis because it essentially involves stretching of fibrous callus. So you are basically stretching the fibrous callus by applying a tensile stress. Okay, now distraction osteogenesis is also associated with distraction histogenesis. Now what is distraction histogenesis? It means the process of new bone formation, that is distraction osteogenesis, is simultaneously accompanied by growth of associated soft tissue envelope. Growth of associated soft tissue envelope. That is why it is also known as distraction histogenesis. Distraction, histogenesis. Now, what is the associated soft tissue envelope? Soft tissue envelope includes your skin, overlying mucosa, musculature. It also includes your new blood vessel formation, and it also includes stretching of the inferior alveolar nerve canal. So all your soft tissues that are growing along with your distraction simultaneously, this process is known as distraction histogenesis. Okay, now 2 or 3 important things here. Principle. The principle is tension more than traction. Please remember this, students. It is given wrong at few places. You may please correct it. If tension is given in the options, please mark tension. If it is not given, only then mark traction. Please mark in this order. Okay. DO initially was used for treatment of non-union of fractures. Hashtag means fracture. Alright, so it was initially used for non-union of fractures. Basic principles of DO were given by Elizarov. Alright, this was a Russian orthopedician who gave the protocols or the phases of distraction osteogenesis, which we will be dealing with in today's session. And type of bone formed in DO is intramembranous. Alright, so these are few important points that you need to remember. Few one-liner questions which you need to remember for your exams. Now, the role of periosteum is very important in distraction osteogenesis. Okay, it is the most important structure that is associated with new bone formation, bone repair, or regeneration. Now, the question is why? Why is periosteum important? Okay. Because periosteum is a two-layered structure. Two-layered structure. It has a outer layer and a inner layer. Okay, now the outer layer is your connective tissue layer. So this contains periosteal blood supply and periosteal nerve supply. Okay, the inner layer is also known as cambium layer. This layer has your osteogenic cells, which are nothing but your osteoblasts. So now please understand, periosteum has all the ingredients which will help in new bone generation. Osteoblasts will have osteogenic potential. They will help in bone formation, and when there is bone formation, it definitely needs a blood supply and a nerve supply. So basically, your periosteum is a treasure. It has everything that is required for new bone formation, regeneration, or repair. Hence, this is a very, very important structure in distraction osteogenesis. Okay. Now, the target areas of DO. What does distraction osteogenesis target so that distraction osteogenesis can take place? So, the first target are endothelial cells. Now, endothelial cells are found in blood capillaries. So, when distraction osteogenesis targets endothelial cells, what does it give rise to? It gives rise to neoangiogenesis, that is formation of new blood vessels. So, new blood supply is being developed. Okay. The second target of DO is osteogenic bone forming cells. Those are your osteoblasts. Alright, so these are the main cells which will lead to new bone formation. So, new bone formation and new blood vessel formation. Both are important. Fine. So, this is important. Now we start with the protocols or phases of distraction osteogenesis. Let us see. There are 5 protocols of 5 phases. Let us see one by one. Each one is important. In case you do not understand anything, you can please mention in the live chat in the comment section below. I'll repeat or I'll explain again. Alright. So the first phase of distraction osteogenesis, atraumatic corticotomy or atraumatic osteotomy. Now, please listen carefully. I'd like to tell you a small difference. Corticotomy is basically used in long bones. In corticotomy, what we do is we are just dividing the cortex. Alright, we are not through and through dividing the long bone. We are just dividing the cortex, the outer cortex, in case of a long bone. Alright. Why? Because long bone is less vascular as compared to a facial bone. Alright. Its periosteal blood supply is not as good as the periosteal blood supply of a facial bone. That is why corticotomy for long bones. Now, you don't need to get into the details. You just need to remember, for face or head and neck distraction osteogenesis, we do atraumatic osteotomy, that is through and through or complete division of the bone. Okay. Now, when we are doing the osteotomy or dividing the bone, our goal is to minimize trauma during osteotomy. Alright, and how is that achieved? That is achieved by low energy osteotomy. Alright, the reason is to prevent bone injury. Now, what kind of bone injury? Necrosis. Please listen, I'll explain. Now, when you are doing an osteotomy, we use something known as an electrical saw. Alright, so I hope all of you have seen a carpenter. The carpenter uses a saw to cut the wood. Similarly, a smaller form of it, we use something known as an electrical saw in the OT. Alright, now this electrical saw is used to osteotomize a bone or cut the bone through and through and divide it into 2. Okay. Now, since this is an electrically driven instrument, it is going to produce a lot of heat or large amount of heat at the interface of the blade and the bone. And when there is a lot of heat production, what will it cause? It will cause injury due to heat. It will cause injury due to heat, or there will be thermal injury to the bone. Now, if there is a thermal injury to the bone, it will lose its osteogenic potential, which we don't want, because we want the osteogenic potential to remain intact. So to avoid this, there were certain guidelines given regarding the critical temperature which has to be maintained at the interface of the saw blade and the bone. Okay, so this critical temperature, it was said that it should not exceed 47 degrees. It should be maintained at 47 degrees Celsius for 1 minute. Alright, or it should not go beyond 47 degrees for a duration of more than 1 minute. So basically you have to maintain the temperature of the bone at 47 degrees and within 1 minute. You should not let it cross 47 for more than a minute. So this is how you will prevent thermal injury to the bone. Now the thing is, it is not possible that after every minute we reapply our instrument or remove the instrument from coming in contact with the bone. That is not possible. So how is it done? How is this achieved? This is achieved by continuous saline irrigation. So the precaution that is taken is continuous saline irrigation. Okay, so the operator will be running the saw and the assistant will continuously irrigate, take syringe in a saline, continuously irrigate the junction of the saw blade and the bone to keep the temperature under check. Okay, and exceeding 47 degrees for over 1 minute will cause thermal necrosis of bone. All right. Now, if there is thermal necrosis of bone, I told you that the bone will lose its osteogenic potential. Okay. So I hope this first phase is clear to all of you who have joined me live. I hope this is clear and we can move on to the second phase. So the second protocol of DO is latency period, delay period, or healing period. Okay, let's understand what is this phase. So today, suppose I have done the osteotomy and I have applied the distractor device inside the OT on the table. Okay, very good, Deepa. I have applied this. Coming to latency period, we have done the osteotomy. Okay, inside the OT on table, we have placed the distractor device. Okay, and inside OT, what we would do is we move the distractor device and see if the osteotomy segments are moving or not. All right. Now, please listen carefully. If you don't understand, please ask me to repeat. You have done the osteotomy. You have applied the distractor device. You have checked the functionality. Now you completely collapse the distractor device and you suture and you bring the patient out of OT. Okay, so today you have done the osteotomy and placed the distractor device, but you will not activate the distractor device today. That means you will not engage the distractor device with its key and you will not move apart the bony segments today. You will wait for a few days before activation of distractor device. In other words, you will wait for a few days till you start moving the osteotomized bony segments apart. Okay, so this time period from osteotomy or placement of distraction device till its activation is known as the latency period, delay period, or healing period. Now, why is this important? Because when you have done the osteotomy, there will be some blood clot, inflammation. So you will let all of these settle for a few days. All right. You will let all of these settle for a few days, and then you will start moving the osteotomized segments apart, and then you will start activating the distractor device. So there is always a delay period between placing of your distractor and activation of your distractor. This period is known as the latency period, delay period, or healing period. Okay. Now, this period is lesser in children and more in adults. So in older individuals, there are certain factors because of which this period is more, because of decreased vascularity, decreased osteogenic potential, decreased healing capacity, and increase in the systemic problems or systemic conditions. Okay. Now, the recommended latency period is, in adults, it is 4 to 7 days. Some books also mention 7 to 10 days. Okay. For children, it is usually 2 to 4 days. So both these points are important. They have been asked as questions, and they can be asked in future as questions. So please remember, in adults, it can be either 4 to 7 days or 7 to 10 days, and in children, it can be 2 to 4 days, the latency period. Is latency period clear to everyone? Whosoever has joined live, please let me know in the comments. Also, please let me know if you want me to repeat. Please let me know. We'll move ahead quickly. So the third phase is known as the distraction phase. Alright, so here your active distraction is taking place. Here you're engaging the distractor device, you're activating the distractor device, you are engaging the distractor device with the help of the key, you're rotating the key. In the process of its rotation, it is moving apart, it is moving the osteotomized segments apart. No, Deepa, adults is not 8 to 12 days. It is either 4 to 7 days or 7 to 10 days. 7 being the common factor, most of the authors agree with 7 days. It is not 8 to 12 days. Okay. I hope your doubt is clear, Deepa. So yes, we were coming to the distraction phase. Now here in this phase, you are actively engaging the distraction device. You are using the key of the distractor device, inserting it into the slot and giving turns. In the process of giving turns, you're moving the bone segments apart. You're creating a gap. And every day you will move the bone segments apart little by little and keep creating gap till you achieve your desired bone lengthening. All right. Now let's see what is under distraction phase. We have two things. First is the rate of distraction. First is the rate of distraction. Okay. Now this is the rate at which fibrous callus should be distracted or stretched. Alright. So the amount of fibrous callus you are stretching in one particular day is basically known as the rate of distraction. I hope I'm clear. So in adults, it is 1 mm per day. Okay, and in children, it is 1.5 to 2 mm per day. Okay, now these are your questions. These are important. You have to remember these two things. So that means in an adult patient, you can stretch the callus by only 1 mm per day. In children, it can be slightly higher, 1.5 to 2 mm per day. Okay. Now for radiotherapy patients, because the vascularity of the bone is decreased, the rate is 0.5 mm per day. 0.5 mm per day. And for small bones with decreased vascularity, naturally small bones are going to have less vascularity as compared to bigger bones. So the rate is 0.5 to 0.7 mm per day. Okay. This is your distraction rate of distraction osteogenesis. Now the second thing is rhythm of distraction osteogenesis. So the ideal rhythm is continuous and throughout. That means if you have to move the callus, or if you have to distract by 1 mm per day, that means there should be a force that has to be applied, or the distractor device has to be engaged in a way that in complete 24 hours there is a continuous rhythm which makes it move 1 mm per day. Alright, so that means there has to be constant engagement of the distractor device to move it 1 mm per day. But that is not possible, because either for that the distractor will have to be electrical or has to be battery run so that it moves on its own for about 1 mm in 24 hours. Alright, so that is not possible. Now how can we move the distractor device for 1 mm per day? Now let me take a very simple example. Suppose you have to give 1000 milligram of a drug to a patient in 24 hours. You can give the patient 2-3 options. Either you ask the patient to take 1000 milligram once in the morning, so that his dose of 1000 milligram per day is met, or you ask the patient, you take 500 milligram in the morning and 500 milligram in the evening, so that makes it twice a day, but when it totals out to be 1000 milligram. Okay, or you can tell the patient you take 250 milligram in the morning, 250 in the afternoon, 250 in the evening, and 250 at night. So 250 4 times a day will add up to 1000 milligrams in 24 hours. Similarly, what you can do here with the distraction is you can give the patient options. All right, suppose if you ask the patient that you can do 1 mm movement once a day, the total will be come out to 1 mm. Okay, or you can tell the patient you do 0.5 mm twice a day, the total movement will come out to be 1 mm. Or you tell the patient you do 0.25 mm 4 times a day, the total movement you will achieve is 1 mm. Okay, now I'll tell you this one, 0.5 into twice is the most patient friendly. I'll explain why. Okay, 1 mm, if the patient is distracting 1 mm in one go, there is a lot of stretch, patient will have pain, patient will become non-compliant due to pain, due to lot of discomfort, due to stretching. Okay, 0.25 mm, if you ask the patient to do 0.25 in over 4 times in a given day, it is very difficult to for the patient to remember that I have to do the distraction 4 times a day. So patient may forget, and then you will not achieve your desired rate of 1 mm per day. So the patient is not compliant if you ask him to do 0.25 mm 4 times a day. And so 0.5 for twice a day, the patient remembers also easily, and it is not very painful for the patient. That is why it is the most patient friendly. Now, what is how exactly do we determine how much movement has taken place? So that slot where you insert your key, all right, that is circular in shape, and it has markings. Okay, here there will usually be a slot to insert the key. Okay, so as per usually the manufacturers tell in their guidelines, in the brochure that comes along with the distractor device, usually the standard is one complete turn is 1 mm. One complete turn is 1 mm, and this turn, 1/4 circle, is 0.25 mm. This is usually the standard in all the distraction devices. Mostly manufacturers follow this. If there is any variation or any difference, they mention it along with the brochure that is available in the packaging. All right. Also, please remember that rhythm of distraction is not dependent on age. Rhythm of distraction is not dependent on age. So whether you're asking the patient to do once a day, twice a day, or 4 times a day, it is completely independent of patient's age. So here इधर कुछ adult का अलग से या children का अलग से नहीं है. Please remember, okay? Is the rate and rhythm of distraction osteogenesis clear to all of you? Please let me know in the comments. Okay. Now, why should rate not exceed 1.5 to 2 mm per day? You cannot distract faster than this. There is a reason. The first foremost reason is it will cause fracture of fibrous callus. So once it causes fracture of fibrous callus, then your entire objective, entire process of distraction fails. All right, because too fast, the what is fibrous callus? It is soft, it is moldable, it is flexible, it does not have the strength of a normal bone. All right, so if you stretch it at a faster rate, it is going to break, it is going to fracture. Okay, second thing is it will cause rupture or tearing of associated soft tissue. So you remember distraction histogenesis session ke second slide mein I told you that soft tissue is also growing along with the distraction osteogenesis process. तो क्या होगा? If the rate of distraction is higher, more than 1.5 to 2, soft tissue फट जाएगा. Alright, then again what will happen? Everything will be exposed to the external environment. क्यों? क्योंकि कोई soft tissue cover नहीं होगा. Okay. Now the third is, if the distraction is more than 1.5 to 2 mm per day, there is increased chance of inferior alveolar nerve paresthesia. If rate is more than 1.5 to 2 mm per day. Alright, so these are all factors which will be problematic to the patient. That's why the rate of the distraction is critical and it is always kept in check. Now coming to the fourth phase of distraction osteogenesis. Okay, this is known as the consolidation period, the consolidation phase, healing index, period of neutral fixation. Now let's suppose that we are doing distraction osteogenesis of the mandible. Okay, and for example, by all our calculations and everything, we needed 40 mm increase in length of mandible. Okay, we needed 40 mm increase in length of mandible. Fine. So distracting at 1 mm per day, we will distract for a total of 40 days. Understood? Simple mathematics. Now, once you have completed the distraction on 40th day, you will not remove the distraction device on the 40th day. Why? Because fibrous callus has still not calcified, it has still not mineralized. Till now you were just distracting. So the fibrous callus is soft, pliable, still moldable. Now you have to give it time to consolidate. What do you mean by consolidation? You have to give it time to mineralize and calcify into strong bone. Alright. So what you do, once a distraction is over, on the 40th day, you keep the distractor device in place, but you do not activate it any further because you have achieved your goal. But you keep it with the patient for a few weeks. You keep it with the patient for a few weeks, but in those few weeks, the distractor device is not moving. Alright. So let's see, the distraction device is present but not moving. Is present but not moving or causing distraction and is in neutral position. Consolidation and stabilization of newly formed bone due to calcification of immature weak bone to dense mature bone. Dense mature bone. Okay, this is what is happening. Calcification and stabilization is happening. Also known as healing index, corresponds to overall healing of distraction bone. So it is the resting phase. It stabilizes newly formed bone, and here very important, you give the patient semi-solid or soft diet. This is important, semi-solid soft diet. Why? Because fibrous callus is still prone to fracture. You cannot give normal diet to the patient or hard, ask him to chew on hard food. Soft callus is still pliable, still moldable, still soft and fibrous, so it is prone to fracture. So you cannot load the fibrous callus like how you load a normal bone. That is why semi-solid soft diet. Understood? Now, according to Elizarov, this is also important. Adults, the consolidation period is 8 to 12 weeks. Children, 4 to 8 weeks. And older individuals, those are elderly or geriatric patient, it is more than 12 weeks. So this is important. You have to remember these values. Okay. Now, I hope the consolidation phase is clear to all of you. Please let me know. If the consolidation phase is clear. Moving on to the remodeling phase. Remodeling phase. Now what you do, remodeling phase comes after the consolidation phase. So let's say, for example, we are talking about a child patient. We kept the distraction device in a resting or neutral position for say 8 weeks. Okay. Once 8 weeks are over, you will remove the distractor device. Okay. Now, once you remove the distractor device, you will ask the patient to go on to normal diet. You will gradually make the patient return to normal function. Okay. And in this phase, what will happen? The trabeculae will reorient and they will arrange themselves or reorient themselves as per the occlusal forces which are falling on the bone. So this is known as the remodeling phase. In this phase, the distractor device is no longer with the patient. You have removed the distraction device and you subject the distracted bone or newly formed bone to functional loading. Understood? So what is happening is, bone is subjected to functional loading. Okay. Remodeling of bone or reorientation of bony trabeculae. This is important. Reorientation of bony trabeculae according to functional stresses and gradual return to normal function. So basically in this phase, the patient can be allowed to take normal diet. So in consolidation phase, soft diet, semi-solid diet. In remodeling phase, normal diet. Okay. I hope you all will remember the phases. With this, our phases are over. I want to now show you a few visuals and give you the difference between child distraction osteogenesis and adult distraction osteogenesis. But before that, I hope the protocols and phases of distraction osteogenesis are clear and you all have understood them. If there are any doubts, you can ask me in the comment section. Now let's see a visual for distraction osteogenesis. Okay. So first, in the first picture, osteotomy has been done. Osteotomy plus fixation of distractor device has been done. Okay. And if you see, I'll zoom out. If you see closely, you can see a blood clot between two osteotomized segments. Okay. Now, from here to here would be your latency period. Okay. Now this is your distraction phase. Both picture B and C is your active distraction osteogenesis phase. Alright, if you see, the osteotomized segments are moving apart, and if you see, I'll zoom out, you can see the fibrous callus forming. Okay, and here if you see, a very thin pink line you can appreciate here. So the overlying soft tissue component is also forming along with distraction osteogenesis. So in this, you can also see a distraction histogenesis component also taking place. You can, I hope you can appreciate the pink line. Okay. Now in picture D, you can see the fibrous callus has joined from two opposite ends. They have met at a point and they are now joined to each other. So this is here your distraction osteogenesis stops and this is your consolidation phase. This is your consolidation phase. Okay. Now here if you see in picture E, you can see that the blood supply has regenerated, the nerve supply has regenerated, and the fibrous callus has now been converted into the host bone, or it has calcified or it has mineralized. So this is your remodeling phase. Okay, so that was an important visual. You can memorize, make a pictographic memory of this visual, and you can memorize all your phases of distraction. Okay, now there are 2-3 things. This is a unidirectional distractor device. What do you mean by unidirectional distractor device? So you can place it in a way that it can cause either lengthening of the mandible, or if you place it vertically, it will cause increase in ramal height of the mandible. All right, it can distract only in one direction. That is why it is known as a unidirectional distractor device. Now this is known, the second one here is a multi-planar distractor device. That means it can distract in more than one directions. All right, now in multiplanar distractor device, you can again have of two types. One can be, it can simultaneously increase the length and the height of the mandible. All right, and it can also have a third component to it where it can change the angulation of the bone. All right, it can change the angulation of the bone, but please remember, it will not cause transverse movement. Please remember, distraction does not cause transverse movement, especially in case of mandible. Okay, so it can be a multiplanar distractor device. Okay, now the last thing for today's session, and this table is very important because it will answer a lot of questions for all of you. I tell this in my class also when I'm teaching in to the regular batches. So there are certain differences between the child and adult distraction. So what are those? Let's see. Now for child, the latency period is 2 to 4 days. For adults, it can be 4 to 7 days or 7 to 10 days. All right, so students, point to note, please go with the option which contains number 7, which contains the value 7 for adults. All right, 7, because 7 is common to both the ranges. All right, the rate for distraction in child can be 1.5 to 2 mm per day. In adults, it does not exceed 1 mm per day. Okay, the rhythm is independent of age. rhythm is independent of age. All right. Consolidation period for a child is 4 to 8 weeks, and in adults it is 8 to 12 weeks. All right. So with that, we end our session on distraction osteogenesis. Please let me know in the comment section if you have any doubts. I'll wait for 2 minutes. You can ask if there are any doubts before we wind up the session. And here is your schedule for the remaining days of this week. You can please note down the schedule for the remaining days of this week. If you are liking our sessions, please share them with your friends. Give us a thumbs up. Comment down below. How did you find the sessions? Ask your queries in the comment section. We'll get back to you. And our in detail lectures are available on the DAMS Alpha app. You can contact the office and get yourselves enrolled. Thank you so much. Thank you for joining in.